Hello everyone, I am Dr. Shubhayu Banerjee, surgical gastroenterologist associated with the AMRI group of hospitals, Kolkata. Today I am going to talk to you about a slightly controversial topic: why a surgical gastroenterologist is necessary for operating on gastrointestinal cancers. Now you see, why do we think cancers are so difficult to treat? Cancers are so difficult to treat because they present in different ways and in different stages. And in a country like ours, where there is no screening program, most of the cancers present at a very late stage. So why are we successful? First of all, in the diagnosis. So we use various blood tests, imaging as in a CT, MRI or a PET CT or an endoscopic ultrasound to ascertain the stage of the cancer. Now, depending on the stage, we then advise the patient about the treatment modalities. It could be surgery, it could be chemotherapy or radiotherapy to start with, and then surgery, or surgery followed by chemotherapy and radiotherapy. And with cancer, the doctor gets one chance to make it correct. So the outcome is dependent on that. Now, what is a oncosurgeon? An oncosurgeon is a specialist group of surgeons who deals with cancers from head to toe. So they can deal with a head and neck tumor, a breast tumor, a lung tumor, an intestinal tumor like a stomach or a pancreas or a liver or a colon, or a uterine tumor or a bladder tumor. So historically, oncosurgeons used to operate on all body parts. Now, with the advent of technology, what has happened is we have realized that there is a subspecialty called surgical gastroenterology, as in people like us who deal with cancers of the gastrointestinal tract. Now, why are we necessary? Because we know if we do one thing day in and day out every day, we become better at it. It's simple logic. So, if I am doing, say, a colon cancer or a pancreatic cancer or a liver cancer or a stomach cancer every day, my outcomes will be better. So I'm not asking anyone to follow the West, but most of our textbooks are from the Western world. Most of our randomized controlled trials we follow are from the Western world, and there organ specific cancer surgery has superseded oncosurgery. So what is organ specific surgery? A head neck surgeon will only do head neck cancers. A breast cancer surgeon will do breast and thyroid. A GI cancer surgeon will only do cancers of the intestinal tract. A gynae cancer surgeon will do a surgery of the uterus and the ovaries. And a uro-oncologist will deal with the bladder, kidney, and so on and so forth. So in our experience now, we see that probably the outcomes are slightly better in organ specific cancer surgery. And as I told you before, cancer is dependent on how good you operate and what your outcomes are, because the better the surgery, better chance of survival. So I give a very small example which I think you will connect with. If it was my father or my mother, who would I choose as a surgeon who does 50 pancreatic cancer surgeries or 50 colon surgeries a year, or someone who does 5 a year and does everything? The answer is for you guys to say. So at the end of the day, I think this is not a debate. This is probably trying to reach out to you guys and say that us surgical gastroenterologists, probably the outcomes are slightly better with us treating gastrointestinal cancers. Thank you.